Well, new problems emerging in the wake of the Democrats' health care overhaul. Yesterday, we saw the dramatic back and forth between the White House and McDonald's over whether that company, McDonald's, will be forced to drop coverage for some 30,000 of its employees. As a result, we're now learning that the Health and Human Services Department may rewrite the rules for 1.4 million Americans, all covered by medical plans that do not meet a key regulation. Critics saying this doesn't bode well for the next couple of years. The thing hasn't even gotten started yet. Joining me now, Dr. Mark Siegel. He's part of our Fox News medical A-team. Peter Morici is a former chief economist for the U.S. International Trade Commission. And Bernard Whitman is a Democratic strategist and a former pollster for President Clinton. All right, Dr. Siegel, let me start with you from the medical perspective, because now we've seen sort of a series of hits over the past weeks on the health care plan. The latest is this dust-up with McDonald's saying, look, we may have to dump these 30,000 people off our rolls if we don't get this special exception into the new law. And now the government says, okay, we'll take care of you. Well, then there's a big question about who else is going to get it. Is CVS going to get it? Is KFC going to get it? Is Target going to get it? All these employers that have large numbers of employees who also won't be able to comply. Then we've had children who are being told no child-only policies by major insurers because they can't afford it. We've had the government admit that costs are going to go up for some people on their premiums, and President Obama said, well, I predicted that, and people said, no, you didn't. It's just been a series of sort of hits on the health care plan before it's even fully going, steam ahead. What are your thoughts on it?
Megan, the first thing is it's obvious that it's not a one-size-fits-all. If they try to superimpose an 80 to 85%, what they call a medical loss ratio, on top of insurers, which is the whole problem going on with McDonald's, they're going to find a lot of employers fleeing. Now, in McDonald's...
And let me just stop you to tell the viewers what that is. The rule is 80 to 85% of the premiums that you basically spend on the coverage need to go toward providing benefits, right?
Right.
And McDonald's says we can't comply with that because we have a bunch of employees and we employ them sort of on the cheap, I guess.
And they're always changing, so your administrative costs are high. If you're losing employees all the time and replacing them, your administrative costs are high. Now, from a doctor's point of view, which is what you asked me, I'll tell you what the worst problem of this is. That 80% that's supposed to go to services, nobody ever tells the insurers how much they have to give to doctors, and doctors end up bringing up the rear of this thing. We see our reimbursements cut more and more and more as the insurance companies struggle to preserve profits by raising premiums. So the patients don't do well because their premiums go up. Doctors flee from these insurances, and we already have a problem with a doctor shortage. This is a total mess. This is the tip of the iceberg here. And they say 2014, the cavalry will run to the rescue. That means putting more and more people on the state exchanges, federal subsidies.
Let me ask you, Peter, because the reports are that several companies are going to be in the same position as McDonald's, maybe. Home Depot, Disney, CVS, Staples, Blockbuster, and others, all in a similar situation to McDonald's. So are they all going to get exceptions from the federal government? And what does this say about a law that you've got all these major corporations potentially having to opt out of part of it before it's even really gone into full effect?
Well, the law did not deal with the fundamental problems in the healthcare sector. We pay 50% more for doctors, hospitals, health insurers, and drugs than they do, say, in Germany, with a private system that just functions much better than ours. Basically, Barack Obama put a lot of requirements on health insurers, doctors, and so forth, including this 80 to 85% rule, but never considered how anybody could manage to comply because they didn't want to take on the hard choices. Now we're faced with a system we can't afford, that we can't implement, and that we can't live with.
But Bernard, you actually have a different view on this. You say, and I thought this was interesting, this whole situation actually proves that the health care law is working.
That's right, Megan. This shows exactly that the health care law is working as intended. How? Because tens of thousands of hardworking McDonald's employees will now be able to get better benefits for less money than they would under the McDonald's plan. And in fact, it shows that the government has flexibility in implementing the health care law as insurers seek to make the absolutely necessary changes they need to become more competitive.
By what? By getting an exemption?
Excuse me, McDonald's...
Wait, let Bernard finish, and then I'll let you guys... Let Bernard finish.
The McDonald's insurance for pretty bad coverage costs $32 a week. This plan will allow them to get better coverage for $21 a week. Less money, better coverage for more Americans in a more competitive insurance industry. That's exactly what this law was designed to engender.
Go ahead, Dr. Siegel.
I was going to just say that, and I'm sorry to interrupt, Bernard, it's about an exemption. So the more and more exemptions we need, the more we show this law doesn't work. And I'll tell you, the draft regulations of this health reform law are going to put everything in a vice. They want lower copays, lower deductibles. That's going to cause higher premiums and a spiraling up of health care costs. We're heading to a tremendous problem in cost here, trillions of dollars.
You know, the thing is, Peter, you hear that lower copays and lower deductibles, and as an insured person, you think, good, yes, I want that. But then you hear if that's going to lead to higher premiums, it's, oh, wait, bad, I don't want that.
Well, absolutely. Many folks are facing much higher premiums this year, and a lot of smaller employers. Now, remember, these are almost minimum wage jobs, but smaller employers that maybe pay $15, $20 an hour are faced with circumstances now where they simply can't afford the health insurance requirements that will be imposed on them, and they're likely to boot their employees into, the federal program, into the exchanges, pay the fine, and the employees will be much worse off then, because they won't have the benefit of the tax exemptions that an employer has and things of that nature. No, and to say the health insurance law, excuse me, created an opportunity for these people to have health insurance, wake up, they already did, and this is causing them to perhaps lose the policy that they have.
They had
now, a real problem here may be how much McDonald's is charging in overhead to run this thing, because I'm having a little trouble understanding exactly why the ins and outs of people cost them so much money to comply when they're only dealing with $2,000 cap policies.
Bernard, I'll give you the last word.
They had terrible coverage for a lot of money. This health care law has already changed the lives of millions of Americans by not allowing kids to be kicked off their policies for pre-existing conditions. Parents can keep them on until they're 26. Wellness visits are now covered. The Medicare donut hole was filled, so seniors are getting reimbursements for prescription drug coverage. I mean, this law, as more Americans understand the benefits, is becoming increasingly popular. Half are now favorable. And frankly, voters are scared that if the Republicans do take control of Congress, the health care situation will actually get worse, according to a new poll.
Okay. Got to leave it at that, gentlemen. I'm sure you guys would like to weigh in, but no, you can't. We're out of time. Dr. Siegel, Peter, Bernard, thank you all so much.
Thanks, Megan.